Turning a group practice into an IOP or PHP in Arkansas changes your licensure posture, your Medicaid readiness, and your revenue cycle. Licensing, Medicaid, and billing all shift, and advertising a structured addiction treatment program before those are pressure tested is the costly way to find out. If you run an Arkansas group practice, expanding into IOP or PHP can look like a logical growth path. This is a diagnostic guide. The licensing, staffing, location, and payer questions to resolve before you change your operating model. Why does the conversion make sense for many Arkansas practices? Arkansas shows visible treatment search demand around addiction treatment, treatment centers, and substance abuse treatment. And you may already have licensed clinicians and a local referral base in place, plus patients who need more structure and more frequent contact than weekly therapy can provide. But the risk is specific to conversion. Under Part 433 of the Code of Arkansas Rules, entities holding themselves out to the public as alcohol and other drug abuse treatment programs must be licensed unless exempted. So, do not assume your existing professional licensure covers a marketed SUD, IOP, or PHP. Licensure standards, Medicaid readiness, payer credentialing, and documentation all need to be pressure tested before the practice advertises IOP or PHP. Here is the strategic takeaway. Do not let licensing, credentialing, EHR, and RCM decisions happen in separate silos. Behave Health is designed to give treatment teams EHR, CRM, RCM, treatment plans, authorizations, and reporting in one platform. And Behave Consulting helps operators translate licensing, payer, and operational requirements into an implementation roadmap. 4 decisions to resolve before you market the program. Work through each one before you advertise an intensive outpatient or partial hospitalization program. Decision 1. Your licensure path. Arkansas has a concrete licensure source to review. Part 433, titled Licensure Standards for Substance Abuse Treatment Programs. Current DHS pages point to the Office of Substance Abuse and Mental Health, or OSAMH, while older official licensure materials still use OADAP terminology. Verify whether your proposed service is an alcohol and other drug abuse treatment program, whether any exemption applies, and what licensure type or review is needed. Decision 2. Staffing and clinical leadership. A group practice manages clinicians and appointments. An IOP or PHP manages a program. That shift changes supervision, clinical leadership, medical necessity documentation, payer communication, quality review, and revenue cycle coordination. Treat staffing as a tailored implementation issue, different leadership, credentials, and clinical records than ordinary outpatient counseling. Decision 3. Whether your current Arkansas location can support the program. IOP and PHP operations can require more group capacity, privacy, waiting room flow, emergency procedures, and documentation time than individual therapy. Ask whether the schedule can handle multiple sessions per week without destabilizing the current practice. Review the space alongside the Part 433 standards, DHS expectations, and payer requirements, and use findtreatment.gov for market research. Decision 4. Arkansas Medicaid and commercial payer strategy. Arkansas Medicaid's Outpatient Behavioral Health Services Manual materials include H0015 with modifier U4 for intensive outpatient substance abuse treatment, useful but not a launch plan. A practice that can bill ordinary outpatient counseling should not assume it can bill substance use IOP without separate review. Verify provider enrollment, facility credentialing, medical necessity criteria, and authorization workflows with Medicaid and each commercial payer. Put side by side. The shift is bigger than it looks. A group practice runs clinicians and appointments. A marketed treatment program faces licensure review and program-level documentation. IOP and PHP workflows create more admissions, authorizations, group schedules, payer reviews, and claim controls than a traditional practice typically needs. This article is a diagnostic starting point, not a launch manual. Verify the details before you launch. With DHS and current official Arkansas sources. With Arkansas Medicaid. With your payers and qualified counsel. And with an implementation partner like Behave Consulting. Before you market the service or commit capital. Stop marketing a program your licensure and Medicaid readiness can't support yet. Scope the conversion with Behave Health. Book a 20-minute demo at behavehealth.com.